I think I can start talking now and I'll be heard. I assume I'm somewhere on the internet. Senator Wiggins is somewhere on Zoom, I'm informed. Let me begin by explaining where we are on optometry. I've said this, I think, to everyone individually, but I'll say it again to everybody here. My goal is to get us wherever this committee wants to go on this issue. And as we've had hearings and various people have discussed the matter externally, and I'll remind you, we tend to forget this from time to time, but there's another group of people on the other end of this building that are meeting. They're talking about bills and having committee meetings. It's just, you know, they do that. And I think they've been talking amongst themselves about it. So where we were is that the optometrists were requesting permission to do a number of procedures that they're currently prohibited from doing. Several of them do not involve the use of lasers. If you take all of those issues and procedures and put them together, that is very similar to the law in Tennessee. Then there are the laser procedures, and I think there are like 4 of them in number, that the optometrists were requesting permission to perform, given that the optometrist had training. The ophthalmologist, feeling they had gone a long way toward trying to compromise, said that they would accept the Tennessee law as a compromise. They didn't like it. The optometrist, feeling that they were giving up the sun, the moon, and the stars in an effort to compromise, said they would give up everything they'd ever hoped and dreamed for, except for one procedure in addition to the Tennessee law. And in defense of both groups, they really started so far apart that what we're talking about now is relatively close to each other. And members had said they wanted a compromise if one could be had, but we were stuck there because lasers are just different, and for a lot of members on the committee, that was an issue. But the buzzword got to be the Tennessee law or the Tennessee law plus 1. And so I was trying to figure out a way to get to the Tennessee law plus a half. One of the features of this is I do believe it would make everybody mad. And I realize there's some people I've yet to offend. And so this would let me offend another group of people in my never-ending attempt to eventually offend everybody. But the idea that I came up with was a pilot project. And I was having a committee sub prepared for the committee, but as I've made it clear to the committee, I think the committee can vote wherever it wants to. It can vote for the pilot project, the Tennessee law plus 1, everything that was in the original bill proposed by the optometrist, or they can move to table. I mean, the committee can vote, and that's fine. But I was just trying to make available to the committee what was there. So what happened was this morning, the House Public Health Committee met and reported out a optometry bill, which is the Tennessee law plus a pilot program. I don't know all the ins and outs and how that came about in the House, but being as they've done that, this piece of legislation is now down there. It's working its way through the system. I feel like it'll get to the Senate and be referred to this committee, but when it does, we will have the advantage of this particular pilot program being picked apart and discussed. We'll have the advantage of the debate on the House floor, and we'll be in a better position to make a decision. So for that reason, my intention is simply to take the House bill when it gets here, which I guess I could have said at the first and moved right along, but I wanted to make everybody aware of what I knew. I have prepared, and there is available, I think, on the website or wherever, an agenda for tomorrow. I have a number of bills for tomorrow. When I say they're non-controversial, I don't mean that I expect the committee to rubber stamp them, and there may be controversy where I don't see it. They look to me like bills that we could look at tomorrow and come to a conclusion about. And so we will meet again with a longer agenda. We have 2 items on the agenda today. They're both doubly referred, and I think it would be well to at least consider the doubly referred bills now before time runs out. The first bill is Senate Bill 2087. I will call that up. I am reliably informed that there is no specific method by which one may disinter and reinter human remains. And a number of folks think it would be well that we have some proposal. This bill was introduced by Senator Wiggins. It comes to us from the Judiciary A Committee. Senator Wiggins and the Judiciary A Committee think well of it. So at this point, I'll ask for a motion, title sufficient, do pass. There you are. That's got a vice chair for, if not to pick up on this stuff. And so the bill's before you for debate. Questions, comments? Ready to vote? All in favor say aye. Aye. All opposed say no. It appears the ayes have it. We'll report that to the Senate.
Thank you, Mr. Chairman.
You're more than welcome. I'll call up Senate Bill 2424, which is the Rural Physicians Scholarship Program. And I will say, I'm just so taken with the whole concept of the Rural Scholarship Program. One of the frustrating things about this committee and this issue that we all deal with is everything is so difficult and it's so complicated, and you never really know what to do, and you're never really sure you're doing something that's right. But the key to the Rural Scholarship Program is we need doctors in rural Mississippi. And the only place we're going to get doctors from is from rural Mississippi. With few exceptions, people are not going to move into rural areas, particularly underserved rural areas where there's not a medical community, which is exactly where we need them. I like to tell people there are exactly 2 graduates of the University of Virginia Law School who practiced law in the history of Amory, Mississippi. Both of us were born in Amory, Mississippi. We were not recruited up there with the big law firms from New York. And, so it's a simple concept, but it really has worked well. And this is actually getting people to go back home who want to and practice medicine. And when I first heard of the program, I've been very taken with it. I had nothing to do with bringing it about at all, but I've just recognized a good thing when I see it. The proposition before us today is to allow 1 additional student to participate in this program, this person being an emergency medical student with the same argument and principle about all of it. So is there a motion on this bill? There's a motion, title sufficient, do pass. Now, is there debate? Senator Hobson.
Thank you, Mr. Chairman. Before we embark upon adding an additional scholarship in this area, do we have data? I've mentioned this, Senator McClendon's briefly discussed this with me, but do we have data to support that there's a need for hospital emergency room physicians in rural areas?
I think you can pretty much take judicial notice of that. I can tell you that in many places, essentially, they're hiring people from these recruitment agencies. And so anywhere in Mississippi you can get a resident emergency room physician, I think that will help. I would say also the definition in law of rural takes in a lot of areas in Mississippi. I don't, to more specifically answer your question, I don't have specific data about that, except to say that there are a lot of emergency room physicians in Mississippi who are being furnished by employment agencies rather than by people who actually live in the community.
Well, I don't doubt that, and you know, my brief tiny bit of knowledge that I have about the emergency room physicians, that many of them live in metro areas and they go into those hospitals in various places and do their 48-hour shift or 24-hour shift or whatever it is, and then go back home. And I just, look, I think it'd be great. I wish we had more physicians in every community, but I unlike a family physician, if we have a finite number of dollars that needs to be located in that community, seeing people on a daily basis, emergency room physicians are just seeing them when they come in for a car wreck or a fall or a gunshot or a construction accident, whatever it is that forces them into the emergency room. I don't know that they've got to develop the relationship that your general family physician would in the community that can see them for the usual, the day-to-day kind of things. Again, not knocking it, but I just wonder if I've never heard this until now, that there's a need for emergency room physicians to be located in rural communities because it's causing a problem in Mississippi.
We have the author of the bill. Do you want to respond?
Thank you, Mr. Chairman, and thank you for bringing this to light. It is true that doctors come in from metropolitan areas, but it's not only doctors that are doing it, it's residents that are also going there. When they get third-year residency, they can go and get paid not for just the emergency room, but for other areas as well, whether it be psychiatry, whether it be general medicine. So all these rural hospitals are having to get doctors from all over. I do not have information on numbers at the present time, which I can get those if we need, but all we're asking for is trying to grow as many doctors as we can for the rural areas. At the present time, it's OBGYN, pediatrics, general medicine, the internal medicine, and as well as psychiatry was added 2 years ago to help with the mental health crisis. With emergency room doctors, we should be adding everything we can to this in all aspects to the rural physicians. As everyone's trying to change their scope of practice, here we've got a way to add to our problem, or to help with our problem. And it's a 4-year commitment that these people have. The state pays for their tuition, and it's not only a program that starts their M1 year in medical school. They go after freshmen and undergraduate to carry them to Ruleville, Mississippi, to say, this is what we do. And it's a program that has really helped Mississippi in the last, since '08. But yes, any way we can get a doctor in any rural hospital or rural setting just makes us a better place and more healthy place. Thank you. And I'll be open to questions.
Hang around if you will. Senator Blackwell?
Thank you, Mr. Chairman. In my experience, having worked in hospitals, hospital ER doctors are hired, their contracts with the hospital. Same thing with anesthesia, radiology, pathology. So the other practices you talked about are all independent practitioners in the community. So why are we, basically what you're proposing is that we hire doctors for these rural hospitals. They should already have contracts with providers to provide those services.
We're trying to get doctors to plant into these rural areas to help with the economy, and this is a way to do that.
I understand that, but what you're doing is you're supplanting the mechanism that is currently in place, that hospitals engage in contracts with emergency physician groups that provide services. Same thing as they do with radiology, pathology, and lab. I'm sorry, anesthesia. So what you're proposing is something totally different now. Am I correct?
I'm proposing for Mississippi rural hospitals to have a chance to have a doctor there that deals with that scope of practice.
Thank you, Mr. Chairman.
Senator Blackman.
Thank you, Mr. Chairman. To Senator Hobson's question, Senator Hobson, Claiborne County, for an example, Jefferson County, Aberdeen, Carthage. I'm familiar with emergency room doctors who they are contractual, but they are there. And they handle colds, falls. It's the uncompensated care people. It's Medicaid, and it's the people who do not have family physicians. They treat those doctors as their family physicians, unfortunately. And so in these rural areas, that's the only service that's being provided is an emergency room doctor, because you're not going to have a doctor to go into Jefferson County because of, you don't have all of the amenities. You don't have doctors, but you have one in Claiborne County, but they just don't have the amenities to attract. Now in Warren County, Madison County, DeSoto County, Hines County, you have the cultural activities that will attract doctors. So I can see this as a means to assist in helping our rural communities.
Senator Parker.
Thank you, Mr. Chairman. This goes back, kind of I'll address it to Senator McClendon and to Senator Hobson. The program, as I understand it, has a limited number of participants. And of course, we have this board here, and I see in the language that we would be adding a new member of the board from emergency medicine there. This would not require one of the scholarship spots to be filled by emergency medicine. It would just open that up as another group that could apply. Is that correct?
Yes, sir.
And there's nothing in here that would require X number of years there to be that particular spot filled.
The only requirement is to be adding one more scholarship, and with the chance of that being a emergency room position.
So when you say one more scholarship, though, you're not talking about one more appropriated scholarship through the existing contract. You're just the possibility that one of those seats could be filled by a different practice.
There's 61 scholarships now. In the bill, it asked to go to 62, and whether it be, normally it's 15 students that are in that graduating class.
Okay.
Whether they be all OBGYNs, whether they be all pediatricians, whatnot. We're just asking for emergency room physicians to have a chance at getting one of those scholarships if one of those kids want to go into it.
So it is increasing the number by one,
Correct.
from 61 to 62 then. And what is the cost to the state for that? I want to say it was somewhere in the 80.
It's $30,000 per year. I'm not sure that we are paying, and tuition has gone up since then, and the state has not allocated up to what a regular student that's not in this program.
Right. Well, I appreciate your effort on it, and I understand that at certain times, we may have more need for one practitioner versus the other, and so I'll be interested to, I'll probably have some side conversations with the appropriations chair to see how the budget looks on that, but.
Thank you very
so
much.
Well, the bill is doubly referred to appropriations, I assume because of the cost of the general fund of the extra scholarship.
Yes, sir.
Moments ago, John Polk appeared before me. Does it mean anything? Is he trying to talk to me? Did he say he wanted something? Well, go back where you were. I don't understand any of this. Senator Hobson.
Thank you, Mr. Chair. Again, nothing against the idea of emergency room physicians if they are located in those communities, but I do, and Senator Blackman, to your point, I'll just give you an example. My father was a surgeon in Vicksburg. He did emergency room every other to every third weekend his entire career until he retired from that at about age 70, I think, 65 or 70. So I would think in that instance, wouldn't you much rather have a surgeon that can do a lot of other things in your community? Maybe this needs to be a surgeon and this not just specialized in emergency room. Or, again, general practitioners can probably do some things in emergency room that may not be able to do surgery in emergency. We get to a point with these scholarships is what's next? I mean, I hear we have shortages in ENTs around the state. Maybe we need to carve out an ENT exception. I know we have shortages in dermatology in the state. Do we carve out dermatologists too and say we need to give them one? Look, I want data. I want to be able to make the right decision based on the information and the needs that we have. Let me throw one other thing in here too, because I'm pretty familiar with this program since I've been dealing with their budget for the last 9 years. And I've had this discussion with Wani Sherman, who's the head of the program. I've said, look, I don't like seeing, I have not made a big deal about this, and no offense, I wish, Senator Williams, I hope you're not listening, no offense. We've had 2 physicians go to Starkville. Starkville's a fine place, a good community. Are we having a shortage in Starkville? Are we having a hard time getting physicians in Starkville? I think we're having a hard time getting physicians in Rolling Fork and in Sebastopol and in Raleigh and places like that. I want to look at our state and say, are we directing the physicians to the places they need to go? I'd love for them to come to Vicksburg. Senator Tate would love for them to be in Meridian. Let's forget about Jackson. He would love Senator McMahon. Jackson's got tons of physicians, but Senator McMahon would love to have him in Tupelo. But are those the areas that we need them to be going to? I think not. I think they need to be going to these places where they can establish a practice and they can get to know their patients and they can work on a regular basis. And whether it's an emergency room physician, Senator Blackman, maybe that's the best thing. Those people, like I know the one doctor in Port Gibson quite well, and he's a general practitioner, but he's going to go into the hospital, he's going to see people at the ER, you're right. But he's not an ER physician, unless he's gotten that specialty, unbeknownst to me. Again, not against the concept, but we've got to really get data for me to be comfortable about making the decision. I'm okay advancing the bill right now, but I want to see some data that says we're doing the right thing as a state before we take this bill much further. And I'll be quiet after that. Thank you, Mr. Chairman.
Mr. Chairman, can I say one thing, please?
Yes.
Thank you. I'm almost certain that there is a population limit that community can have, and I think it's 15,000 people that the physicians can go to. And they spend 4 years at a community less than 15. I'm almost certain of that, but I will double check those numbers as well to see what the maximum size community it can be. And that's all I have on that. Thank you.
Dr. Hobson, where did you finish undergraduate school? In law school?
Pardon?
Law school?
Chair?
That's 7 years?
7 years.
It's just so interesting to hear someone who spent 7 years at the University of Mississippi talking about what a wonderful place Starkville is.
I could have picked Laurel, too.
Always
Laurel's got a couple there.
anticipated.
Jones College.
Open? It's just, everybody wants to go to Starkville, you say. Okay. I would say that if anyone anywhere wishes to tighten the definition of what a rural area is, I think that would be an excellent thing to do, because we do need to try to get people out in the most rural of rural areas. Is there any further debate? We ready to vote? All, the motion's title sufficient to pass. All in favor say aye. All opposed, no. It appears the ayes have it. It appears the ayes have it. We'll report that to the Appropriations Committee. Is there a motion to rise and report? There's a motion to rise and report. All in favor, aye. Opposed, no. Thank you. Thank you, those of you